Hey everybody, this is Dr. Ben Pearl with FitFootU. So today we have a follow-up venous insufficiency ulcer. So I have done 3 electromagnetic treatments. We're going to do a 4th one today, and we're going to lay down a fish graft called Keracys. We're only going to need a smaller piece because we've already had some contraction of what started out as about a 7 by 5 centimeter wound, and now it's shrunk down so that the innermost part is maybe 4 by 4, 5 by 4, something on that nature, depending on what type of exudate. So without further ado, we're going to get a close-up just on the ring, and let's go ahead and start the wound treatment. Once we do this for about 7 to 10 minutes, this is just getting some vascular flow going, some cutaneous vascular flow. We are then going to add the fish graft, which is right here, and I am going to fenestrate the graft. And what that means is I'm just going to score it so that I can stretch it out like a spider web so that we can allow that exudate to drain without flopping off the graft. Now, there is a step forward. Would you suggest that we fenestrate this probably before we put it in the saline? Otherwise it'll just fall apart. So I'm going to pre-score this first, and then off camera we're going to put it in the saline so that it becomes a more flexible, pliable graft. And then we're going to lay that down on the most deepest portion. And what I'm doing is I'm making little slits here that are only about 3 millimeters each. And Dr. Pat Agnew suggested I do this in almost like a overlap star pattern of how you would do a flag. And just to make sure that I am fully through, I'm just uplifting a bit so we don't just pre-score it, but actually you can see that we've scored it. We don't need to get too much of the belly of the tip in. So anyway, once we do that, we're gonna circle back. I'll have a little bit more of a net. We'll time lapse this so we can shorten up this segment. So now we time lapsed and we've Swiss cheesed of sorts the graft so that we can allow some exudate. I'm now going to place the graft. I'm going to get the adaptic to be the next layer. So layer 1, I'm going to kind of get it oblong here, and that's on the sensitive part of the most open exposed portion of the wound. Then what I'm going to do is we're going to get the adaptic, sterile scissors here, and what I'm going to do is just do this, and I'm going to take over here on this one. Thank you. And then if you can close that back up for me, please. I'll let that drop off and pass it off to Zoraida. Like this. And then we're going to do a little wound gel next. Okay. If you can do me the honors and just, and then just, you can put a little bit in my hand there. Thank you. All right, thanks. All right, just get a little wound gel there. What I'm going to do, so let's do it this way. Put the gauze on, and get the wound gel with it. I'm just going to reapply. Got one layer at a time here. Stagger these. And finish with some cling. And then we're just going to let this be for 7 days and let the Keracys do its thing. See if it incorporates. Hopefully it will. And we'll be able to gauge how much exudate is left. And take a couple tucks here just to get a little more padding over the shin. And then we'll follow this wound. We'll have a part 3 of this episode when we take off the dressing to see how the graft is incorporated. Until next time, this is Dr. Ben Pearl with FitFootU.